Hello everyone, it's Dr. Michael. In the previous video, I was talking about how I passed the ICO Visual Sciences examination in less than 6 months, and I shared with you the study materials that I have used, and in particular I was talking about this book called MCQs for FRCOphth and ICO Basic Sciences Examinations by Samir Krita. And I told you that there are some mistakes in the book, and in this particular video I'm going to talk about those mistakes one by one. And we are going to start with this question about physiology. It's question 29 in physiology on page 31. And it says, which of the following receptors suppresses aqueous outflow? Answer A, alpha 2 agonists. Answer B, beta adrenergic agonists. Answer C, muscarinic antagonists. And answer D, cholinergic antagonists. And when you read the answer, it says that answer A is the right answer. And it says that alpha-2 selective adrenergic agonists suppress aqueous flow via an inhibition of the adenylate cyclase and act on alpha-2 receptors, which are located in the ciliary body. So pay attention to the word ciliary body. It means that this outflow should be replaced by secretion, in my opinion, because the ciliary body actually secretes the aqueous humor instead of causing the outflow of the aqueous humor, because outflow means the circulation of the aqueous humor from the anterior chamber to the trabecular meshwork, not its secretion from the ciliary body. And about epidemiology and biostatistics, you have question number 10 on page 143. It basically asks the sensitivity and specificity about this test called ESR. So ESR is the test that is evaluated here, and pay attention to this number 90, which is the total amount of patients that tested positive for the ESR test. If you draw the 2 by 2 table from the question, you have here the number 90, which is the total amount of patients that tested positive for the ESR test. And in that particular case, you would have 0 as the true negative test. And when you calculate the sensitivity, it gives you 86, because sensitivity is calculated as the number of true positives over the total amount of the patients that actually have the disease, so biopsy positive. And the specificity would be 0 if you have the total amount of patients that tested positive for the ESR as 90. You would have 0 as the specificity, because specificity is calculated as the true negatives over the total patients that actually doesn't have the disease. And when you get back to the question, you would notice that none of the 4 choices actually corresponds to the calculations that you made. but it looks like answer A could be the right answer, except the specificity is 0 instead of 33. But if you replace 90 by 80, you would see that now you have a specificity of 33%, and you would know that answer A is actually the right answer. And when you read the answer on page 309, you would also notice that the specificity is calculated as 10 over 30, not 0 over 30. So it means that the total amount of patients with ESR positive test is actually 90. It is actually 80 instead of 90. About anatomy, there is the question number 57. Actually, there is nothing wrong with the question, but it asks about the corneal endothelium. And when you read the answer on page 183, it explains you that there are approximately 350,000 cells per millimeters cube per cornea instead of just 350,000 cells. It's not cells per millimeter square, but just the total amount of cells per cornea. And also it says that damage to the corneal endothelial cells and the density below 1,500 per millimeters cube usually leads to corneal edema. Once again, this is wrong because it is actually 1,500 per millimeter square, not cube. So be careful about that. That could be a pitfall during the exam. And then there's question number 64, also about anatomy. There's nothing wrong with the question, but when you read the answer, it says that cones are connected by an inner fiber to sphericals instead of pedicles. So sphericals are actually for rods, not cones. So be careful about that. And also about anatomy, there is the question number 66. It asks about reflexes involving the facial nerve. And the statement number two says that the effector muscle of the loud noise reflex is the medial pterygoid muscle, which is wrong. But when you check out the answer, it says that the statement number 2 is true, but actually the effector muscle of the loud noise reflex is the orbicularis oculi, so this should be false. And also I think that this phrase is also wrong. It says that the efferent pathway is carried by the temporal and zygomatic nerves of the facial nerve instead of saying branches. So branches would be more accurate, I think. Question number 83 about anatomy. It's about the blood supply of the orbit, and the first statement says that the posterior ciliary arteries divide into 4 short and 4 long posterior ciliary arteries. And this statement is false because actually there are only 2 long posterior ciliary arteries which are located at 3 and 9 o'clock or nasally and medially in the globe rather than 4. Now about physiology, there is question number 40. So in this question that asks about smooth pursuit movements, it looks like all the 4 choices are accurate about the smooth pursuit, but pay attention to the question because it asks you which of those choices is not accurate. And if you read page 327 in the book called DI, 4th edition by John V. Forrester, you would notice that the smooth pursuit movement latency is actually 150 milliseconds. So the choice D should be accurate, meaning that it's not the right answer since the question asks which statement is inaccurate. So I think that in this particular question there's no answer because all of the 4 statements are accurate. And also about physiology, there's the question 60, which talks about pain, and it says that pain receptors show adaptation with loss of sensitivity with repeated stimulation. And when you read the answer, it says the opposite. Pain receptors show little adaptation and in some cases repeated excitation leads to increased sensitivity. So that means that the statement number 5 should be false instead of true. And question 62 about physiology is asking about the vitreous, and the statement number 5 says that the vitreous in children is more liquid than that in adults. But when you read the answer, it says that with increasing age, the vitreous degenerates and liquefies, meaning that it would be more liquid in adults. So statement number 5 should be false instead of true. Question number 89, also about physiology, is asking about the parvocellular pathway, and the statement 5 says that the parvocellular pathway is important for special discrimination, and here the answer says that the statement number 5 is false, while as it explains that the parvocellular pathway is important for special discrimination, which means that this should be true instead of false. And about pathology, there's the question 38 talking about macular corneal dystrophy. And statement number 5 says that the inheritance is autosomal recessive, and the answer says that this statement number 5 is false. And when you read the explanation, it says that actually inheritance is autosomal recessive, so this should be true instead of false. And question 42, also about pathology, asks about metaplasia. And statement number 1 says that metaplasia is irreversible. And the answer says that it's true. And it explains that metaplasia is reversible. So it means that this should be false instead of true. Question 54 is about chemical mediators of inflammation. And the statement number 5 says platelet activating factor is derived from mast cells. And when you look at the answer, it says that that statement number 5 is false. But when you read the answer, the explanation in the answer, it says that platelet activating factor is actually derived from mast cells. So this should be true instead of false. And now about embryology. Question 32 asks about the optic stalk. And the statement number 1 says that the optic stalk is an outgrowth of mesoderm from the brain to the retina. And I think that you would easily correct it, because the optic stalk is actually an outgrowth of the neuroectoderm from the brain to the retina. So statement number 1 should be false instead of true. About therapeutics, the question number 39 asks about opiates, and statement number 3 of the question says that they may cause respiratory depression, and statement number 4 says that they may cause diarrhea. And when you read the explanation in the answer, it says that opiates may also cause respiratory depression, and the answer says that statement 3 is false, while it should be true. And opiates may also cause constipation instead of diarrhea, meaning that statement number 4 should be false instead of true. And this last question, which is about epidemiology and biostatistics, in page 146, it's question 20, is not actually a mistake, but rather it's an outdated data about the common eye conditions. So there's nothing nothing wrong in the question, but when you read the answer, it explains that about 284 million people are visually impaired worldwide, and 39 million are blind, and 245 million have low vision. 80% of all visual impairment can be prevented, treated, or cured. And all of those numbers are inaccurate anymore. If you read the World Report on Vision by the World Health Organization, so if you read that PDF, you would find out that it says that at least 2.2 billion people have a vision impairment or blindness, and of whom at least 1 billion have a vision impairment that could have been prevented or has yet to be addressed. So all of those numbers were wrong. They are not accurate anymore. And also, uh, this book also says that 65% of visually impaired people are over 50 years of age. This number is not accurate anymore. It should be 80 instead of 65. And it's also in the PDF called World Report on Vision. So, in conclusion, there are 15 MCQs that have mistakes in the question or in the answer in this particular MCQ book, and the prevalence and incidence for the most common eye conditions are not relevant anymore in that book. And be aware that I didn't check out the MCQs for optics, lasers, and instrument and patient investigation because they are not asked in the ICO Visual Sciences examination. So thank you for watching this video, and give it a thumbs up if you like the video, and subscribe to my channel for more videos to come, and good luck for your ICO Visual Sciences examination.